Do I really have diabetes? I feel totally fine. I hear this a lot, and if you've ever thought that, you're not alone. So let's talk about how diabetes is actually diagnosed, why those numbers matter, what they really mean, and why even if you don't feel anything right now, it might still be something you shouldn't ignore. According to the American Diabetes Association, there are a few ways to diagnose diabetes. Fasting blood sugar of 126 or higher, hemoglobin A1C of 6.5% or more, 2-hour glucose over 200 on a glucose tolerance test, or a random blood sugar over 200 if you're having symptoms. That includes things like frequent urination, constant thirst, increased hunger, and unexplained weight loss, the classic signs of diabetes. And just to be clear, if you don't have any symptoms, the first 3 tests, fasting blood sugar, A1C, and the oral glucose tolerance test, usually need to be repeated on a different day to confirm the diagnosis. That's because blood sugar levels can vary from day to day, and doctors want to be sure before making it official. Now, these numbers aren't just picked out of thin air. They're based on big studies showing that when blood sugar gets above these levels, your risk of things like heart disease, kidney damage, and nerve problems goes way up. But in real life, most people get diagnosed using one of 2 tests: fasting blood sugar, or A1C, and sometimes both. So what do they actually tell us? Fasting blood sugar shows how your body handles glucose when you haven't eaten. It's kind of like a resting snapshot. If it's high, it often means your liver's pumping out too much sugar, or your insulin isn't doing a great job of shutting that down. In short, your blood sugar regulation system might already be under stress, even before you eat anything. A 1C, on the other hand, gives you the big picture. It shows your average blood sugar over the past 2 to 3 months. Basically, it tells us how much sugar has been sticking to your red blood cells over time. That's why doctors often use both. One shows the moment, the other shows the trend. Can test results be off sometimes? Yeah, it's possible. Let's start with A1C. A 1C is usually a reliable way to measure your average blood sugar, but sometimes it can show up higher than it really is. If you have iron deficiency anemia, your red blood cells live longer and collect more sugar. So the A1C can look falsely high. The same thing can happen with vitamin B12 or folate deficiency, because your body isn't replacing red blood cells quickly enough. Chronic alcohol use, especially with poor nutrition, can also skew the numbers. Some medications, like certain antivirals or narcotics, may interfere with how A1C is formed or measured. And in some people with kidney failure, substances in the blood can affect the test, depending on the lab method. That's why doctors don't rely on just one number. They look at the full picture. Now, what about fasting blood sugar? That number can show up higher than it really is, and there are a few reasons for that too. If you accidentally had coffee, milk, or even gum before the test, it can raise your blood sugar. Stress or being sick, like with a cold or fever, can also cause temporary spikes. If you didn't sleep well the night before, that can affect how your insulin works. Medications like steroids or beta blockers can also play a role. And if you smoked before the test, nicotine can trigger stress hormones that raise glucose. Again, it's not super common, but it happens. That's why, if your first result is high, a good doctor won't rush to label you. They'll usually repeat the test, not just to confirm it, but to make sure there's nothing else going on behind the scenes. When symptoms do show up, they often look like this: peeing more than usual, always feeling thirsty, feeling hungrier than usual, losing weight without trying, feeling tired all the time, blurry vision, cuts or wounds that heal slowly, or frequent infections. These are some of the most common symptoms we see. And the first 4 are what we call the classic signs of diabetes: frequent urination, constant thirst, increased hunger, and unexplained weight loss. But here's the surprising part. A lot of people don't have any of these symptoms at all when they're first diagnosed. No thirst, no fatigue, no warning signs that feel off. And that's exactly why regular testing matters. Diabetes often starts out silent, but that doesn't mean it's harmless. The earlier you catch it, the better your chances of staying healthy and preventing long-term damage. How common is diabetes? Honestly, very. In the US, more than 38 million people have diabetes. That's over 1 in 10 adults. Among seniors, it's nearly 1 in 3. And nearly 100 million more adults have pre-diabetes, and most of them don't even know it. So, if you've been told your blood sugar's a little high, or that you might have diabetes, you're definitely not alone. But here's the thing. What really matters isn't just whether you have it. It's whether you find out early enough to do something about it. So, if you've been told your blood sugar's high, or that diabetes might be on the table, don't ignore it. Don't brush it off as a lab error. Talk to your doctor. Repeat the test. And most importantly, take action early. Because diabetes isn't a wait and see kind of thing. The sooner you know, the better you can manage it. Even if you feel totally fine now, your future self will be glad you paid attention. Manage your health wisely and stay updated with real doctor tips. Doc for you. Trusted medical advice from a real doctor